So one of the things that most new graduates are uncomfortable with in the intensive care setting is ventilator troubleshooting. Being able to quickly and accurately troubleshoot a ventilator alarm is probably one of the most important things about being an ICU therapist. For the most part, ventilator alarms can be divided into two categories: high pressure alarms or low pressure alarms. Marcus and I are going to simulate a few of these ventilator alarms for you and what to do in the instance of each one. We'll start with high pressure alarms. High pressure alarms are anything that disrupts the delivery of a breath. The most common causes are the patient coughing, biting the ET tube, mucus plugging, right mainstem intubation, decreasing compliance, and can also be caused by the suction catheter being left in line.
Pressure, pushing down on me, pressing down on you, no man has fallen.
Excuse me, will you come to room 333? The patient's ventilator will not stop alarming.
Sure, no problem. I'll be right there. So what's going on?
The ventilator won't stop alarming.
Okay, well, let's take a look. Oh, wow. It seems like the patient's coughing a lot. We can try to suction him.
I suctioned him twice and I didn't get anything out.
Oh, okay. I don't know. He doesn't look real sedated. Maybe we could go up on his Diprovan. If you see you have a ventilated patient who's coughing excessively, it's usually for one of two reasons. Your patient could be producing a lot of secretions and might need suctioned. But in this situation, the nurse had already suctioned the patient and didn't get anything out. In this situation, though, your patient is clearly uncomfortable. We have to remember that mechanical ventilation is not natural. And without the proper sedation, you're going to have poor patient ventilator synchrony, and you're going to hear a lot of alarms. It's up to you and the nurse to troubleshoot that ventilator and see exactly what the problem is so your patient can be as comfortable on the vent as possible.
Excuse me, will you please come to room 233? The patient's ventilator will not stop alarming.
Wow, those are high peak pressures. Oh yeah, he's definitely biting through that ET tube. Similar to the last scenario, this is another situation you can run into if your patient isn't sedated enough. There's a couple different ways to fix it. You can work together with your nurse or your doctor to find more appropriate sedation for your patient, or you can place a bite block.
He's on 40 of Diprovan. His pressure is low and I can't go up anymore.
This is another situation in which it would be appropriate to place a bite block.
Can you come to room 323? The vent won't stop alarming.
So what's going on?
I just turned him over to give him a bath and the alarm won't stop going off.
Oh, okay. Let's try to suction it. Oh yeah, he's full of secretions. Oh, I can't get the catheter to go down any farther. He might have a mucus plug. Give me a bag. Mucus plugging is a very common cause of high pressure alarms on ventilated patients, especially after they've been moved for a bath or to be turned. Many times you can advance the suction catheter, apply pressure, and get the mucus plug dislodged. If you're unable to advance a catheter, you could try bagging the patient and instilling saline to dislodge the mucus plug. Okay, so we'll go ahead and go down a little bit. Throw some saline down. Marcus, go ahead and bag. Good. Oh yeah, there it comes. Mucus plugs large enough to totally occlude the patient's airway need to be addressed immediately. If you can't dislodge it, the ET tube may have to be pulled and the patient might have to be reintubated. Of course, we want to do everything to avoid this, as this is our last resort.
Come back to room 223. The vent has not stopped alarming.
Oh, here's the problem. The catheter got left in the circuit. Just gotta pull it out. When you finish suctioning, always be sure that the black indicator is located in this window. Remember that when you suction a patient, pushing that catheter into the ET tube reduces the diameter of the airway by half. To compensate for the reduction in the airway size, the patient's work of breathing has to increase 16-fold. Always be sure before leaving a patient's room that the suction catheter is pulled all the way back out. So So those are some of the most common causes for high pressure alarms on the ventilator. Now let's take a look at low pressure alarms. While low pressure alarms are most commonly caused by a simple patient disconnect, a leak is a leak and can be found anywhere in the circuit, as well as the pilot balloon. The site of the HME is one of the most common places for a circuit disconnect. For the patients who've been intubated for a long period of time, it's also possible for the circuit to disconnect at the ET tube hub. Remember that anytime you have a significant leak anywhere in your circuit, a low pressure or circuit disconnect alarm will occur. It's important to check the entire circuit, starting with the patient, to be sure there are no leaks. Two of the more common places include the two valves on the inspiratory limb of the vent circuit. Be sure these are closed. If you're sure you have a closed circuit and you continue to have a patient disconnect alarm, you should check your pilot balloon. You want to be sure your cuff is intact and holding the right amount of pressure. Here you can see the pilot balloon is totally flat, meaning there's no pressure in the cuff. This could mean your cuff is totally blown, or more likely that the valve is broken and has a small leak. Try to refill the pilot balloon first. If the pilot balloon doesn't hold any air, then you've got a problem. Our hope is always that it's just a leak in the pilot balloon line and not in the cuff itself. You can place the Pressure Easy device in line with the patient's circuit. It will take lost air from the circuit and place it back in the pilot balloon line to maintain patency. However, if this does not work, your pilot balloon continues to go flat despite putting air in, and you continue to have a leak, you may need to contact a physician. It's possible you have a blown cuff.